Disclaimer. Any of the guidance offered by the podcast host, myself, or the podcast guests is our own guidance. We are not liable for any of the actions the podcast listener decides to do. Welcome back to the Self-Esteem and Confidence Mindset podcast with me, Johnny Pardo. And today I welcome Dr. Elliot Justin, and we're going to be talking about erectile health and much more in terms of the work that Elliot's doing in the world and all the people he's been helping out there. So, quick introduction to Dr. Elliot. So, Dr. Elliot Justin, MD, FACEP, is a serial healthcare entrepreneur, board-certified emergency medicine specialist, and the founder and CEO of FirmTech, a pioneering company at the forefront of data-driven sexual medicine research. FirmTech's flagship products, the Tech Ring and Performance Ring, combine sexual wellness and smart technology to help men monitor their erectile and cardiovascular health. The Tech Ring's embedded sensors measure nighttime and sexual performance data, empowering men to track how lifestyle factors, medications, and fitness levels correlate with their erectile function and cardiovascular health. The ultimate goal: to prevent, manage, and even reverse erectile dysfunction and heart decline using personal, actionable health data. The Tech Ring has documented data from over 168,000 erections under Dr. Justin's leadership. It's become a groundbreaking research tool used in studies with several leading sexual medicine institutes. Dr. Elliot, welcome to the show today. Glad to have you.
It's great to be here, and I want to make the point that not all of those erections were mine.
Okay, good to
It's
know.
on almost 4,000 men.
Wow.
It's the world's largest database of men's erectile health and performance.
It's a lot of data. So thanks for clarifying that as well. There was a combination of different guys, and wow, you're doing a lot of work out there. You've got a lot of data, a lot of research. I'd love to know, first of all, Elliot, what drove you to help in this area of life, to help men with erectile health?
Well, it has to do with living in Montana. I own horses, and I tend to ride exuberantly. My wife says I ride like a 15-year-old. I say I ride like at least like a 25-year-old. But sometimes I can have this illusion that I'm a centaur, like I'm one with my horse, and that can be a dangerous illusion. So I'm certain that the tree is still complaining about me, but I broke 6 ribs and 6 vertebrae. Fortunately, even though I broke bones in my back, I didn't injure my spinal cord. But that got me interested in what's been done to rehabilitate men's sexual function, or who've had spinal cord injuries, or women for that matter. And there still are 6 papers in the medical literature claiming that they were able to neuromodulate sexual response in men with spinal cord injuries or multiple sclerosis. By neuromodulate, people should think cardiac pacemaking, which most people are familiar with, basically placing an electrode by a nerve and then we stimulate the nerve with electricity, with a generator. We tried it on 2 rams, male sheep, and we got a weak erection, we got ejaculation, but we also got defecation and urination, so it wasn't quite bedroom friendly. Maybe in certain pockets of London, Sydney, New York, it might be bedroom friendly, but not not for the general population. That ordinarily to do what you do then is you'd go out and raise a lot of money and then test it out on men with erectile dysfunction in Nigeria or Brazil. Instead, I had a friendly urologist insert electrodes by my cavernous nerves and pudendal nerves. Every guy's, frankly, probably every woman's 2 favorite nerves that are responsible for arousal and climax, and the nerves that come out from underneath the pubic bone and go into the clitoris and the penis. So we implanted an electrode, and we tried all sorts of amplitudes and frequencies, voltages, and I felt nothing other than mild irritation from being mildly shocked. I still don't actually think we know the neurophysiology of arousal in people. I think what's in the textbooks is probably wrong. On basis of experimenting myself, but I tried to write it up as a negative report, but negative reports almost never get published. I called it Project O for obvious reasons. Years later, a urology professor at the University of Utah heard about this, and he was trying to come up with a way of counting the number of nocturnal erections that men have because of the leading indicator of their cardiovascular health, which I'll get to in just one second. At that time in my career, I had moved into becoming sort of consultant liaison between the doctor with an idea for a device, the businessmen who want to make money, and the engineers who want to make a product that's too expensive to be commercialized. So he engaged with me to come up with a count number of nocturnal erections. And I was unaware that nocturnal erections are a leading indicator of man's cardiovascular health. In medicine, we treat associations. There are very few leading indicators in medicine. A leading indicator means it's predictive. So in medicine, we treat the elevated lipoproteins because associated with atherosclerosis. But if your cholesterol goes up, doesn't mean you're going to have a heart attack. We treat high blood pressure because it's associated with stroke. But if your blood pressure goes from 130 to 150, it's not predictive. But if the number of nocturnal erections that a man has goes down by 50%, that man has close to 50% chance of having a cardiovascular event in the next 2 or 3 years. So that took me aback. That'd be like another vital sign, and one to be a lot more interesting to men than their blood pressure or their pulse, and a lot more motivating, potentially, to change people's behaviors so that they could lead healthier lives. And the number of nocturnal erections is also indicative of the status of one's sexual health. And because sexual health and cardiovascular health are linked, because in the end, it comes down to blood flow. If your heart's not pumping blood, or the arteries are too narrow to get blood to your penis, you're going to have a problem. So that's the background. It goes back a little bit over 4 years. We started working on this project.
Oh, that's it. Yeah, it's a lot of work, a lot of research you've done, obviously, over in that time. What is perhaps one of the myths around erectile dysfunction, or maybe a couple that you've kind of
Well, there are two. There are two big ones. The biggest one has been revealed by the research on the number of erections. And here's how the problem came about. Back in the 90s, erectile dysfunction was defined as, by the International Society for Sexual Medicine, defined as the inability to attain an erection or the difficulty in maintaining an erection. Well, it turns out those are two totally different groups of people who shouldn't be grouped together. The men who struggle to get an erection, in general, have a pump problem, they got angina, heart attacks, congestive heart failure, the heart's not pumping enough blood. And often in combination with, they have a pipe problem. The arteries that take blood from the heart to the penis are narrow due to diabetes or atherosclerosis or hypertension. And therefore, those men, to my mind, have dysfunction. They're not getting enough blood into their penis. But it's only about 12 to 13% of men who are diagnosed with ED. The vast majority of men get an erection and then lose it. And those men, if you get an erection, your heart's pumping enough blood, the pipes are wide enough to get blood into your penis. You might benefit from taking a pill, putting more blood in. But the problem is you're losing your erection. Vast majority of men, and all men experience this as we get older. Even you, a young man like you, Johnny. Johnny, if a girl pecked your cheek when you were 12 years old, how long did you get hard on for? 15 minutes, half an hour, an hour? When was the last time it happened to you? You don't have to answer the question. But it's true. All men experience fading erections of aging. All of us lose our erections faster as we get older, but no one talks about it. It's just, and why is it happening? Could be for tremendous variety of reasons. All the reasons come down to blood leaving the penis. So before we talk about all the other reasons, and I will in just 1 second, therapy should be directed at keeping blood into the penis once you're hard, and only a ring will do that. And if you told me 4 years ago that I'm going to be promoting erection rings, I would have said, no effing way. I don't need it. But now I realize it's not about need. It's about want. It's about wanting to optimize your performance. Whether a man is losing his erection because he feels guilty about cheating on his wife, or maybe his wife is cheating on him. He shouldn't have had those last 2 cocktails. Maybe dancing for another hour was a mistake. Smoking that entire joint, that might have been a mistake too. Baby crying in the next room, or he's taking medications that we doctors prescribe that interfere with the ability to sustain an erection. And there are certain antihypertensives, beta blockers that do that. And the SSRI antidepressants and anti-anxiety medications are notorious erection killers. But if he's getting blood in, the primary therapy is a ring. Rings are more effective than pills, and the two work best together. That's what our data shows. If a man wants to optimize his performance, put a ring on and take a pill. So those are really the two big myths. One myth is if you have ED, you probably have a problem with your heart, and that's not true. If you have ED, the answer is a pill, and that's not true. Pills put a little more blood in, but they don't keep it there. Rings are more effective. The first problem came about because of misdefinition, because these two groups of men who struggle to get an erection, and if you have that problem, you see a cardiologist and neurologist. You probably have a significant cardiovascular problem or diabetic problem. But then there's the men who get an erection and lose it. Almost a completely different group in terms of the causes and the therapy. I'm at war with the phrase erectile dysfunction because it's shaming. It leads to men not seeking help, and often getting the wrong help. They're embarrassed to talk about it with their partners. They're embarrassed to talk about it with their friends. They don't want to talk to doctors about it. The doctors don't ask them questions about it. And what do men do? They get pills. And I don't know how easy it is in the UK to get pills online. In the United States, it's extremely easy. There are numerous telehealth services, and they all have a questionnaire that's going to make pretty much, so you're pretty much going to have a purchase, recommended to you. I'm not saying men shouldn't take pills, but if you're truly interested in optimizing your performance and preventing ED and the confidence issues associated with ED, put a ring on that.
So I'd love
rings. And then maybe another point. Straight guys have this notion that rings are for guys who have fetishes or they're gay, and that's just wrong thinking.
So these rings, how do they work in practically for someone who's got one?
Sure. Well, the tech ring is the world's first wearable to track your sexual health. How does it work? We've embedded sensors into an erection ring. I don't like calling them cock rings because it doesn't really say what it is, and kind of the association there was with a novelty you get in a sex toy store. So we embedded sensors into an erection ring. I like calling it erection ring because that's what it's doing. It is giving you data about your erection and helping to sustain your erection. So we embedded sensors. As your girth expands, the sensors fire. And they're two sensors, and with 2 data points, the computer algorithm then translates this into a 1 to 10 firmness score, and also measures how long the erection lasts for. So with this information, men can then measure the doctors and measure the impact of diabetes, hypertension, atherosclerosis, medications, alcohol, recreational drugs, relationships upon someone's sexual health and someone's sexual performance. We've had 3 men that get cardiac catheterizations because the data was so poor. We've had 3 men that we're aware of who are going to get penile implants. So realized they didn't need it because they're having nocturnal erections, in which case they realized that their ED was actually in their head. And so that's how it gets the data. And there's an easy to use phone app. The data is stored in privacy on the cloud. People receive computer interpretation notifications about their data. Could be, hey, John, you're having twice as much sex and your penis is 20% harder this month. Way to go. What's changed in your life? Or it could be, hey, Elliot, since you started on that medication, your erections are 30% less hard. Perhaps you should discuss with your doctor and consider taking another medication. So that type of intelligence, is built into it. But the other way they work is they compress superficial veins. So, and that holds blood in the penis. Conventional erection rings are these O-rings made out of silicone. They pinch, they're uncomfortable. They made the same stupid way for the last 150, 160 years. And they've never really caught on because they're uncomfortable, because they cut off the circulation. They're essentially a gasket or a noose on your dick. And who wants to lynch their dick? Our rings are made out of, because I got involved, redesigning rings was kind of secondary. I really got into this for the data. The urologist said he wanted to count and assess the number and quality of nocturnal erections. And I realized I had to reinvent the erection ring. I couldn't go with these hard silicone rings. I had to come up with a material that would allow the arterial blood to flow in, but also for performance, provide some constraint on the venous side to hold the blood in, especially when your penis is erect. So our devices are made out of elastomer, not silicone. And elastomer is softer, it's more comfortable, it adapts to us. Silicone makes us adapt to it. And so I realized after I was starting to generate data on men's nocturnal erections that it actually solved what I call the cock ring problem, which is that they've just been barely designed, but for a long time. And then realized that we should study not just the nocturnal erections, but we should study the impact of a well-designed erection ring on men's sexual performance. So we did an internal study, and then there have been 2 other independent studies of detumescence. Detumescence is the time it takes for erection to go down after climax. So the longer it takes for erection to go down after climax, the more blood that's been held in the penis, the more intense the orgasm, the more sensitive the organ, the happier both people are as well too, probably. With nothing, an erection goes down about 25, 35 seconds. With 10 milligrams of tadalafil, Cialis, which is the most commonly prescribed erection pill probably in the world. It's around 2 minutes. With the ring, it's around 3 minutes. With the ring plus the pill, it's a little over 4 minutes. And the takeaway for that, for all men, should be, put a ring on it and take a pill. And that's a changer for the way in which men think. Now, back before you were born, late 1970s, 1980s, when I was still dating and was, in residency or just finished residency, vibrators were just becoming popularized. And right now they're normative. We think of them as, that's totally normal, but they weren't. I mean, they've been around for a long time. I mean, they were steam powered vibrators back in the, 19th century. And then there were ones that were with powered by electricity starting in the 1920s, but no one was smart enough to try to commercialize these. It's kind of stupid the way we look back. We look back and you think it's kind of like wheels on a suitcase. Why didn't anyone think about that earlier? Anyway, back in the late 70s and early 80s, people in the UK, United States, around the world, frankly, started to commercialize vibrators, make them slimmer, make them quieter, et cetera, et cetera. And there was this huge concern that women would become addicted to them, or that they'd be numbing, or that women would prefer them to men. That might be true, by the way. But because they became popular, we no longer stopped, and feminists came along and said, well, you can't describe women anymore as being frigid, anorgasmic, cold, hysteric. Maybe they can in the UK, I don't know, but in the United States, that's just can't do that anymore. That's considered to be appropriately to be sexist and also shaming. But men still get saddled with this erectile dysfunction, and most men are not dysfunctional. They just got a problem, and the problem can be fixed by using data to figure out what's causing the problem. But in the acute situation, by putting a ring on it to, once you're hard, to stay hard with minimal stimulation.
So the ring does both that. It collects the data to understand what could be the problem, whether the problem could be a physical thing or could be a mental thing. And then it also can help with performance as well.
Yeah. Plus, the ring also allows men to give them an important signal about their cardiovascular health, because a healthy man should be having 4 to 6 nocturnal erections per night. But you don't know, you, Johnny, and you, the vast majority of men in the world don't know, because you're never assessing that important data. I'm confident that what we're doing will become a standard of care in the United States, the UK, around the world over the next 3 or 5 years. It might not involve using our device, because there will be copycats. But in terms of the data points, right now, John, if you went, or I went to a doctor for a physical because I had a problem, and the doctor didn't do any tests, we would think, what is this, 1900? And we expect healthcare in the 21st century to be objective and data-driven. But when it comes to sexual health, it's not. When it comes to sexual health, it's stupid. It's just, hey, Johnny, hey, Elliot, got a problem? Take this pill. I'll see you in 3 months or 6 months or 9 months or never again. We don't just give out blood pressure pills or anti-arrhythmia pills without data. It's time to make men's healthcare data-driven, because we are all of us on the road from erectile fitness to eventually to erectile dysfunction, but we don't know where we are on the road because we don't have a dashboard. So, crashes and breakdowns are going to occur because we don't have any data. So now men can get data and figure out and use that data for preventive purposes, or use that data to figure out what works for them. So the data is being used. You can decide what the right dose of erection pill is. You can decide what the right dose of testosterone is for you. You can decide whether you're going to benefit from any therapy, pelvic floor therapy, shockwave therapy. And if you have a problem, you then monitor your progress, because now you have objective data.
Would it be able to, and does a ring allow you to measure things like testosterone?
No, that has to be done separately. You have to, you need blood. You can't do it done slide, but you really need blood to measure testosterone. And I don't, in the United States, it's like with erection pills, it's pretty easy now to get testosterone online. I think the United States is pretty much unique in the world in making it so easy to get testosterone. But there's something, and that's nice. It should be easy to get, but it also should be data driven. So it bothers me in the United States that, if you go online and you fill out a questionnaire and say, I know my energy is not what it used to be. I'm kind of fatigued, have brain fog, and my libido is not what it used to be. You can get testosterone. But all those questions are subjective. Everyone wants more energy. Everyone wants to sleep better. And no one knows what the fuck libido even means. It's important to quantify these things. And especially in this age now, where there is a lot of appropriate concern about men being low T in the UK, United States. Testosterone levels today, blood levels, are 40% of what they were 25, 30 years ago. That's alarming. It's a whole other issue as to what's causing that. But I take care of several men right now in my practice who have T's they're in their late 30s, early 40s. They've got T's of old men who are 25, 30 years old now. But you don't know what the right dose of T is to give them, unless you're also measuring their nocturnal blood flow, measuring their muscle, and quantifying libido. Libido to me is about sexual initiative. The question I ask patients is, how many times a week are you initiating sex, or are you receptive to sex? and what's your goal. And with the right dose of testosterone, you can move men who are complaining about, oh, I only want to make sex once a week. I think it's abnormal for guys 40. If you want to make sex, we'll have sex once a week. You can move them to 2 or 3 times a week, changing their lives and changing the lives certainly of the partners as well too.
How could just walking through like from the data of like a ring, obviously, yeah, like you touched on there, testosterone, something you measure through like, getting your blood taken and things like that. But if a man was using like the ring, how would he be able to tell if the problem was like mental or physical?
Well, that's the easiest one because if you, I joked before how all the erections weren't mine. Well, when we launched the company like a little over 3 years ago at CS in Las Vegas, we had like 1,200 erections, and probably 25-30% of them were mine and one of my engineers. And now it's thousands of men. So if you use our technology with a database of over 3,000 men, you're comparing yourself, and if you're between the ages of 35 and 70, you're comparing yourself because we give men comparative data to men who are 5 years old to 5 years younger. You're comparing yourself to what's average for those men and also what's optimal for those men. So the top 10 percentile and the median. So you can then say, gee, if I'm having a healthy man, how old are you, Johnny?
I'm 35.
35. So you should be having 5 nocturnal erections per night. And if you are having, if you're having 5, and you're having, not pick on you, but if a man your age is having 5, but he's not. If he is having 5 and he's having trouble performing, the problem's here. It's mental, far more likely than not. Now, if you're a 55-year-old and you should be having 4 plus to 5 nocturnal erections, and you can't perform and you're having those nocturnal erections, the problem is here. On the other hand, if a man your age, or more likely a 55-year-old man, is having 2 nocturnal erections, or 1 nocturnal erection, there's a good chance that problem is a cardiovascular problem or something worse. Our youngest customer was 24 years old. His wife got him a ring because he wasn't able to perform in bed, and he had an adrenal tumor and he wasn't producing hormones. It could have gone on for a couple of years with him before he figured that out. We've had the 3 men I'm aware of who got cardiac catheterizations. All of them were blaming their wives or their partners for their sexual problems, but they were the ones with the problems. They had a cardiac problem, and they would. I'm not going to say that the technology saved them. They might not die, but they probably would have gotten a heart attack without utilizing without our technology. So that's the point. If you're having adequate average or above average nocturnal erections, which our device will tell you for your age group, the problem is far more likely to be psychological or relationship related.
Got you. How long does, and say like if you're using like a 35-year-old, for example, and it's 5 nocturnal erections at night, how long would like the individual like be testing that for over a period of?
We like to get at least 3 readings because there's variability. Ideally 6 readings. Why is that? But just like your blood pressure fluctuates, your number of nocturnals can fluctuate, and the quality of sleep can affect it. Alcohol can affect it. Stress can affect it. Who you're sleeping with. So the more data points you get, the more accurate the computer interpretation is, but 3 at a minimum.
And if and for guys who like the physical way, so if they identify it's like low, then a case of going to sort of like explore that a bit more with some sort of like blood tests and a doctor potentially.
Every man, especially every man, pretty much from age 35 on, should at least one, if not once a year, every 2 or 3, every couple of years, get their testosterone and their free testosterone tested, and that should become the standard of care. I mean, it's just important. It's likely more important than your cholesterol, your hemoglobin, so many other things that we test for. It just hasn't, and it's unfortunate, become the standard of care anywhere. In the United States, you have to pretty much demand it, as part of you can go to a lab and get it done. Because in the United States, you can actually go into any lab and have any test you want done. But as far as your doctor recommending it or ordering it, you got to demand it, because it's not part of what the insurance scheme covers. I bet it's the same in the UK. I bet the UK does not cover. Have you ever had your free testosterone done?
No, I've done it via a like paid test.
Yeah.
We've got like a company or two, but like free tests, I'm not so sure of. So I can't say no, but
it should be covered by the health plans. It's so important.
Yeah. So with like, if you say someone who's got like a mental challenge, in terms of they discover that, I mean, do you feel like the ring and the pill can sort of help with that, or there are other
Absolutely
strategies?
Because Men, the question that men need to ask themselves is the one that the definition screws up. Is my problem I struggle to get an erection? See a doctor. I get an erection, I lose it. That's not really ED. And the ring, and that's a common problem for guys with confidence issues. Guys who are men my age who are widowed and dating younger women online. They meet online. Guys your age who are single and dating. Guys should recognize it's normal to get an erection and lose it the first couple of times sleeping with someone frankly, because of trust and confidence issues. The ring fixes that problem because once you get hard, the ring is going to keep you hard with minimal stimulation.
Got you. Yeah. And then the pill as well.
Pill as well. Pill puts some more blood in, the ring keeps it there.
And are there any other kind of, although I guess it varies from person to person, and you mentioned about like therapy and stuff like that.
Yeah, but I don't, therapy without getting your data, if a therapist is treating a man or a couple for sexual problems, and it turns out the guy has two or less nocturnal erections. His problem is probably physical and not mental. Similarly, it's important for people to understand that because a lot of guys don't want to think that their problem is mental. They want to blame some other factor, usually their partner, or something in their background. But if a guy's getting nocturnal erections, it's valuable but it's in therapy. It's important that guy now can understand, my problem is mental. There is something going on in my mind. And or it could be alcohol, it could be other things as well too. But what else, what am I doing personally in terms of my vices or in terms of my relationships that I can't perform because the problem is not going to be solved just by taking a pill.
What do you think of I know it's talked about a lot, about like the role of porn on men's erections?
To me, look, I think this is being vastly exaggerated. Porn, think about, we men get dumped on in so many ways. We got erectile dysfunction. We got toxic masculinity. We have the death grip from masturbating. Why is it my wife's hand's a love grip, my hand's a death grip? I don't understand that. And then we have porn addiction. Well, this is really addiction. I mean, the average guy confesses to watching about 70 minutes of porn a week. Is that addiction or is it pleasure? Most men are capable of distinguishing between fantasy and reality. I mean, let's talk what porn addiction would really be like. Right now, Johnny, if you were interviewing me, but I'm so addicted, I've got another computer going on here, and I'm watching women with giant shoe high heels standing on men's chests because I'm addicted. That's addiction. Similarly, if because of watching pornography, I can only have sex with women who have 38 double Ds. Well, that's a problem, but that's not the vast majority of men. And I've got men that I take care of whose wives, they diagnose them with porn addiction because the women don't want to, quote, compete with porn. Well, and then these guys are like, well, what are you doing? Well, 2 or 3 times a week I masturbate. Because my wife doesn't want to have sex with me every day, and I want to. That's not porn addiction. So I think this is being exaggerated, and just becomes another way of dumping on men. We don't complain about women being shopping addicted. I mean, women, they say that porn built the web. Okay, I'll accept that. But shopping sustains the web. The web is all about it's shopping. Women spend, lowest estimate, 4 times as much shopping as men. High estimate, over 10 times as much time shopping as men. They get dopamine hits in their brain from shopping and making purchases, just the way men do from watching porn. People have done comparisons, though, with the brains. Granted, the studies are really small and limited in numbers, but, talk to your wife or girlfriend about her shopping addiction, and she'll look at you like you're crazy. So this porn thing, I'm not going to say it's bullshit, because I'm certain there are men. Okay, here's another part of the problem. The therapists, psychiatrists, and urologists, they see the sickest people in the practice. And they are seeing people, what they tell me, who really are addicted. They're addicted to the point where it affects their job, it affects their taking care of their kids, it affects their health. That's addiction, but that's only a small number of people. Let's not project from the sickest onto the general population, many of whom find porn to be healthy. There's a huge study in the United States showing that men in their 20s who watch porn are more likely to get married than men who don't watch porn. And that's they're attributing. Here's the logic of that one. I don't know if I believe the conclusion of the paper. The conclusion of the paper, this big paper, like 3,000 men, that men who watch porn are going to look for the same thing from women. So they want to get married. They're going to be looking for sex? No one. And of course, isn't that the number one reason why guys talk about marrying? I mean, it's part, it's just part of the joke about men. We're only as good as our last 2 or 3 orgasms, right? I mean, if a guy has a limp dick 2 or 3 times in a row, he's probably mentally ill. He can't think straight. He's going to have lack confidence and have poor self-esteem issues. So I don't know. I think the porn overall is not the problem.
Okay. And I like your data-driven approach with like the ring and how you're looking at things to actually identify like what is going on each night, and then therefore getting a bit more clarity for men on, is it physical, is it mental, and then exploring in that and just using data on themselves.
It's a game changer. We need to take andrology, men's sexual health, into the 21st century objective, data-driven, and most important, personalized, individualized, targeted care. Because we're not all one size fits all. One of the biggest mistakes that doctors make, medicine makes, is we treat everyone as a one size fits all. You got high blood pressure, take this one pill. You got high cholesterol, take this one pill. You got ED, take this pill. But we're all different. What's the right dose? Is it working for me? Is something else I should be taking? With our device and with other wearables, you can get data that's for you. You become an N of one.
I like that. Yeah, not one size fits all. I think that translates into many different things as well, certainly in my experience. So yeah, data-driven work that you're doing. So Elliot, I know you're doing a great deal of service in this area. You've done so much research, that 168,000 plus, and all the years you've been putting into this. So as we wrap up today, I'd love to know, where can the listener find your products, what you're giving to the world, where's the best place, or to connect more of your work? And finally, is there a final point you'd like to leave us with today?
Yeah. Well, if you want to read about the research, there are like 5 or 6 published papers, and another 10, 12 papers either completed or underway that have been presented at international meetings, urology, andrology meetings. You can go to the science section of My FirmTech, MyFirmTech, myfirmtech.com, click on the research button, and you'll see all the papers. If you're interested in purchasing our products, similarly, go to myfirmtech.com. We also, as Johnny, we distribute in the UK as well.
Yeah, absolutely. That's awesome. Yeah, and Elliot's links will be in the show notes below. And yeah, obviously you're in US, but you're also in UK, which is great for our listeners because we're kind of worldwide here. So,
well, we distribute in the EU, Korea, Japan, Australia as well.
I love it. So yeah, for the research that Elliot's talked about, the papers, the work they've done, and then those products, you can find those in the show notes below. Just click on the links. So Elliot, I want to thank you for some really fascinating insights I've learned today, and I'm sure the listener has, and thank you for all the work you're doing and all you shared today.
Thank you. Thank you for the opportunity. Put a ring on it and take a pill. Optimize your performance and your pleasure.
So that concludes today's episode. And remember to lead with your heart and not with fear.